District Health Officer. Madam Wazir, she is Additional Deputy Commissioner Nowsheta. This is a gift for you. Madam, this is District Health Officer Nowsheta office. So please come in. Assistant Commissioner Nowsheta. So all district admin. Okay, please have a seat. From Health Department, from the district administration. You know, this district Nowsheta is one of the district of Central Khyber. It's a gate. You may travel to the north or the south. So this is one of the central district. Geographically, this is one of the, but this district has a very hot terrain. This Dr. Sarfaraz and Dr. Riaz, they worked here in Nowsheta, they know it. If you just come to Nowsheta, second, we are getting support, you know, from the WHO, from so many, this is a multi-sectoral support from the WHO. They are providing technical support and the technical people are here. PEI and EPI, all these things. And this flood effect, flood passing outside this wall, you can see it from here as well. And in 2010, people like Dr. Sarfaraz, and they know that this was badly affected by the flood. Even you are sitting in this office, this office remains submerged for more than 1 month. Disrupted the infrastructure of the whole district, particularly of the health facilities. In 2022 flood, and that has created so many complications. Like at that particular time, we were having a dengue outbreak in Nowsheta, and the people who moved from the flood-affected area to those. In all these regards and other public health measures, we are getting support from the WHO. So we are very thankful to you. So on my behalf, to this lane of hospitality in Nowsheta, to listen to you.
Thank you. WHO is always supporting the government of Pakistan and Ministry of Health in particular. We have few programs we are really supporting. One is the polio eradication initiative, our polio program, EPI. We are extensively supporting outreach program as well as technically, and then the RMNCH, the maternal and child health, and then when it comes to any other emergency. So floods, since first day we were on ground and supporting how to respond to the flood situation, and Pakistan was very badly damaged due to floods. So across the country, and KP is one of the provinces where so much of damage, and Nowsheta is a district where people were much affected. Today we are donating a large quantity of medicines, which will be helpful for you as DHO to support the other primary healthcare institutions, comprehensive healthcare, essential healthcare services to the people, and also with your, and also we will provide necessary equipment and furniture as well. And then beyond that, we can discuss how best we can support in supply of equipment when it comes to maternal and child health, and also supporting nutrition as well. So we have established 45 is another area we need to focus, so we can extend our support in nutrition as well. So department, the DH office, and also support the people of Nowsheta strong and sustainable. So we are very much open. We'll come again to see you, and we will come again to probably once these facilities are renovated, to declare it open, and also let us know whatever the way that we can support. Our teams are here to extend all support to you.
Thank you, sir. Thank you very much.
The hospital that is established, and Dr. Saniola is there, and we have already provided support to that NSC and district headquarter hospital NSC. That is in our pipeline, and hopefully in near future we will be establishing that as well.
So
We will be re-establishing that.
so we will undertake the renovation starting. Okay, we'll do that because nutrition is an important area.
We all people sitting here, they know and we all know. Some of the people, they are working with us in like.
Yeah, we will discuss and KP.
We have 26.
Campus were established during Alhamdulillah, they provided us good support, but at the same time they also face a lot of patients that we much of the medicines. There was a shortage of medicines and the mosquito nets that were provided by the health department. So we were coping with the different situations at that time, but Alhamdulillah, with their cooperation, with their collaboration, we overcome all these issues. And now I must say that from April to March, we have different types of activities. So at that time, we are again district administration in collaboration with the health department, trying to overcome the difficulties that future regarding the dengue.
That in flood 2022, with the support of the district administration and online, it was single epidemic.
Yeah.
Things were under control. Even measles didn't receive. We didn't receive any. Under 5-year children, pregnant ladies, all these were. They were properly.
It was not easy with the surveillance services, and then LHWs, all our LHWs were engaged in those dengue surveillance areas or protected areas. We were providing the services to the dengue patients, and at the same time we were coping due to cooperation and collaboration with the health department. We overcome all these difficulties, and alhamdulillah, no casualty was reported during these floods. And inshallah, we will try our best to continue these services more successfully with the health department.
Wonderful, great commitment by all healthcare workers. I always tell the flood response by Pakistan is remarkable, and we all, the entire nation, needs to salute to the healthcare workers. They really work very hard. It's a good example for other countries also to see how West Pakistan responded.
So I've seen on the Facebook many times.
At the beginning, to introduce me.
Please sit around.
I was unsurprised, that's what I'm saying.
All this happens because of teamwork. If your team is strong, then the leadership will automatically be strong.
Dr. Shoaib basically started his career working with us in the poly program since long. We were like kids to the program. You know, we
Since late 1994,
94, yeah, exactly. Then he another. But he's very supportive to the team and our colleagues here, Dr. Asad, with our other colleagues. Right side is the area coordinator.
Yoga is still there and polio is still there.
Yeah, so we are doing our best. But Shoaib Sahab is really working very hard. Specifically in EPI, there is a remote area which is Nizampur.